Coming up on the Doctor's Hospital podcast.
Kids returning to school will lose approximately about 2 months of the grade level proficiency that they had before the summertime began, right? And that was really interesting for me.
Doctor's Hospital Specialist Clinic is where trusted and best care meets consistency and dedication. Let our expert specialists take you on a healthcare journey where warmth, compassion, and your well-being come first. From diagnosis to prescription, we are with you every step of the way, ensuring your peace of mind. Visit us today at Centreville Medical Center, Collins Avenue and 6th Terrace, and discover quality, compassionate healthcare at Doctor's Hospital Specialist Clinic.
Welcome to the Doctor's Hospital podcast. I am your host, Alexis Burrows, Marketing Director at Doctor's Hospital. And here today, joining me on the podcast is Dr. Teykia Deveaux, who is a pediatrician working in the Doctor's Hospital health system. Welcome to the show, Dr. Deveaux.
Good morning, Alexis, and thank you for having me on today.
Awesome. So we have you here today to talk about managing kids' health during the summer. So I am a parent of 2 kids. I know you are likewise the same. And summer is always an interesting time, especially as the kids start to get older. Because they're a little bit more out of your sight. They may be with the grandparents, they may be at a summer camp, they may be on an island, all sorts of things. I know for me personally, I spent a number of summers in Long Island when I was small with my grandparents, and we don't talk about those days. I was joking that to tell people I came up in a time where I know both sides of our technological divide. So most of the summers I spent in Long Island, I had to walk to the Telco office to call home. There was no electricity in my grandparents' house and most people's house in Long Island at that time. So it's a very, very different time. So obviously it was a lot of riding the bike up and down the island, going and swimming, going on the boat with this one, that one, the next, that sort of thing. So we know summer is a time where there's a lot of potential dangers and issues that exist out in that space. So we wanted to get you on the podcast to talk about some of these things, kind of give parents some guidance, and I guess educators, people who work in some of these health summer camps and summer programs, just to give them some guidance on how to manage and help to deal with children during this time of year, because obviously there's a lot that's going on, inclusive of vacation and everything else. So to get started, we're going to look at things around sun safety, hydration, outdoor activities, that sort of thing. So what are some key steps parents should take to protect their kids from things like sunburn and other sun-related issues during the summer? And I'd also ask you to just speak to the myth, because sometimes people, we are a country that is predominantly, of African descent. Mm-hmm. And so therefore, sometimes people think, well, sunburn doesn't apply to us here, or we don't have this issue of sun-related issues for our skin. So kind of speak to that a little bit as well.
Boy, you would really understand that this sun is sunning this summer, right?
Right, it is.
So your summers in Long Island, I don't think they're quite the same as the summers we're having right now.
Definitely not.
And so with kids being outside this summer, we want to, start with having them apply sunscreen to most of their body. And we're talking about broad spectrum sunscreen with at least an SPF of 30, and SPF stands for sun protection factor, and the at 30 you're protecting against at least 97% of those rays that we found to cause skin cancer, and to really give that good protection. So before the kids go out, about 15 to 30 minutes before outside to hopefully play, you want to apply it to their skin and then reapply every 2 hours if they're swimming or heavy sweating, etc.
Right. So this is not just for like beach and pool activities. This is generally just being out in the sun.
Generally every day. Okay. Every day we should be applying sunscreen. My daughter hates for me to remind her, but definitely it's a part of our morning routine to put on that sunscreen. And, over the past few years, we've released sunscreen. I think a part of it too is it leaves this white cast on the skin. So we do have a few brands out there now that you can rub in nicely, and for women moms can wear under their makeup, and the kids can put it on. It has a little bit of sheen in there, so you don't even have to put on that extra Vaseline before they leave the house.
Right. I remember my wife was telling me, I think it was about a year or two ago, she was like, she started using this particular, I can't remember what it is, something in her morning routine, and it was the SPF was in it. I'm like, so you putting sunscreen on like just as an everyday part of your routine? And she was like, yeah, like they have all these different things now. I guess my question about the SPF. So what is the difference between those numbers? Because you said 30, but I know you see some things and it's like 50, 75, all of these different numbers. What does the number mean? Why is that important? Because, I hear 30 and I'm like, wow, that's really low. Like, should it be 50? Should it be 70? Why that number? And then what does all of the different variations mean?
So the numbers kind of give you the percentage at which you're blocking some of those UV B
Okay.
rays specifically. So at 15, you're blocking about 93%, 30, 97%, and about 50, 98%. So 30, a lot of the sunscreens, especially for kids, will be around 30 to 50 at minimum. Because they're going to be outside longer. For parents or adults, usually the makeup and stuff like that, if they do include SPF, will be around 15 to 10.
Okay.
And so you just want to make sure you're getting enough protection. People don't think about we're driving in the cars if you don't have really heavy tints, which sometimes you're not even allowed. You're allowing those rays to come in a day at the beach, standing outside to these, lots of birthday parties that they love to have outside. You want to have some protection on. And then you also want to have protective clothing. So you don't want them in hot stuff. You want light, cool, cotton kind of material. And then sunglasses and a hat. The hat is very, very important. Obviously, I have 2 kids. I know it's very hard to remember where the hat is at all times and then keeping it on, but as best as possible, especially for those that are playing sports like golf and tennis and other things like that. You want to make sure when they're outside playing with the hat, make sure that they're seeking shade appropriately, right? And so playing during certain times of the day, or if they're outside during those high peak times, make sure it's in a shaded area.
Trust me, it'd be hard to keep track of. Did he kick the shoe? Because I have a 1-year-old, so you know the drama. It's like, where's the shoe? You walking in the food store and you realize there's only one shoe on the foot. So when you start talking about things like hats and all of that, but I also realized too the thing with clothing. Like I realized in the last few years, we've moved so far away from, you just want like the cute swimsuit or the cute, and everybody's like rash guards, right? And so that's become this thing where it's like, no, you want to make sure you're covering as much of the skin as possible because it just keeps getting hotter and hotter and hotter.
Yes.
So, and I do think again, same thing. We had my son out for his first pool day a few weeks back. And this idea of reapplication every 2 hours, if they're in the water, if they're actively sweating, is a very important note. Because sometimes people think it's like a set it and forget it. You go, you put on your sunscreen, you go to the beach or you go outside, and that's you for the day. But again, I think that's an important note for people to remember as well. So obviously you can't talk about the sun without talking about hydration. Because obviously you're out there, you're sweating, you're hot, you're going to lose a lot of liquid. How can parents ensure their children stay adequately hydrated during hot weather? And what are some signs of dehydration that they should watch out for to let them know, hey, maybe my kid isn't getting enough and I need to kind of ramp it up?
Yeah, this is definitely the time to really push H2O. There's nothing that replaces or beats good old-fashioned water. Even so, we allow kids to start taking water at 6 months of age. Nobody needs anything else, right? Water can sustain you sufficiently. So we like to encourage them to drink lots and lots of water by having that available, maybe a dedicated cup, or everybody has a tumbler, whether you're part of the O'Wallach family or the Stanley family, whatever, the knockoffs, whatever it is, just make sure we're giving them lots and lots of water. And, they have some, you can add some fresh fruit to it to give it a little flavor, whatever it takes to make it appetizing or enticing to them. But just encouraging your kids to drink water at every, maybe it's every hour. Did you take a sip? Or every 30 minutes, did you take a sip if they're outside and you see that they're sweating a lot? That would be very important. And there's also hydrating foods, right? So there's cucumbers, there's watermelons, there's oranges, making those kinds of fruits and vegetables available to children. If it's in the fridge, but it's not cut up and readily accessible, it's just like it isn't there. So taking that time to just set it out, make sure it's available to them. And I mean, watermelon is what it says. It's a melon filled with water. And so sometimes they may not grab for the tumbler or their cup of water, but if they're drinking stuff through, what they're eating, that helps with dehydration status as well. So you do really want to watch out for signs like dry mouth, dizziness, if they're not peeing a lot, right? If their urination is not as frequent as it should be. And then looking to see if they look more sleepy or tired than they should be, or it's out of proportion. And those are the main signs of dehydration. Kids can get dehydrated pretty quickly, really, really quickly, because they're small, right? And their body surface area is important. And like I said, the sun is sunning. So you really just have to be careful, especially out there with the camps. A lot of them are outside. Or they're in places where they don't have like full air condition. So you want to take breaks, bring them into the shade, make sure they're drinking water, giving them, orange slices, watermelon, etc., just to make sure that it's a safe and fun summer.
Okay. Sounds good. Again, talking about that sun and the idea of being outdoors, like I said, we live in very different times. So my parents are quite comfortable with me being in Long Island with my 60, 70 something year old grandparents riding around on a bicycle, and maybe not anybody knowing quite exactly where I am at any given moment in time. But obviously things have changed a lot over the years. So when you start to think about, what are some safe and healthy outdoor activities for kids to take part in? And then even in that space, what are some precautions that parents or caregivers, program like summer camp leaders can take to just ensure safety?
Yes, times have changed, and you're more likely to know where your kids are now. During the day, you don't let them just out and roam about, but we do want to make sure that they're out and about. So that means outside and playing, moving their bodies. Encourage as much physical activity this summer as you possibly can. Biking is still a skill. I haven't mastered it yet, but it's still a necessary skill, I think, for children. So biking, swimming, going for walks. Let these kids be bored this summer. Let them come up with games. Let them be creative. Let them play hopscotch. Teach them some of the older games that we used to play that didn't require, just get them out from the screen this summer technology. And away. Well, I don't want to say away from a technology, but give technology a break and utilize the creative sides of their brains, right? So it's really important. So I'm encouraging swimming. I'm encouraging biking. I'm encouraging, getting in there and play, but just make sure they have the right proper equipment, right? So your brain, your head, your skull, very important. It's very strong, but a helmet is key, right? So we like that. Protective gears, if you can add knee pads and elbow pads and things like that, I think that's very helpful. If they're swimming, you have to supervise, right? Even the strongest swimmer can get a cramp and that get themselves into trouble. So if you're having kids swim in a pool, you have to have somebody dedicated to just watching those children. People can drown really, really quickly. And I'm hoping this summer that we can avoid any of those tragedies, right? That we are so frequently hearing about. So just definitely having good supervision when you're in the water, obviously applying your sunscreen, and then these mosquitoes are out. So insect repellent as best as you can.
My poor kids, I don't know what it is with the mosquitoes, but they love them and they get ripped to pieces. It's interesting too. We are generally speaking not a culture that likes to do like things like floaties and things like that for kids in swimming, but I imagine that's also something that you would encourage. Even if, obviously if your kid is older and stronger, it might not be as necessary, but definitely with your younger kids, I imagine flotation devices like arm floaties and things like that would be recommended as well.
So actually we try to discourage those floaties.
Oh, really?
Yeah, so it gives the kids a false sense of that they can swim, right? And so a 2-year-old, you have their floaties on and then you put them in a pool on Monday, right? On Wednesday, they didn't put together that they don't have the floaties on, so they think they can just go in the pool and do the same thing they were doing, but there's no floaty, and then you get into trouble. And so really important at an early age is to really introduce swimming lessons, right? We're an island nation. There's water everywhere.
Fair point.
Swimming is key. I think that's the most important thing to focus on. If you're going to use any kind of devices, it should be life jackets. I know they have these things called puddle jumpers. They have the floaties on the arms, but they don't put the child in the right position. And then it makes actually learning how to swim a little bit more difficult. So key point would be to engage your children in swimming lessons, to get comfortable with the water, and to know what to do to get to a safe spot if they're in a pool. And like I said, very, very close supervision whenever they're in at the pool or at the beach. Yeah.
That's interesting. I think that's a very important note of clarity, because I think, sometimes you look at it and think, okay, you want to keep them safe. But I guess from the standpoint of that false sense of security is better to get them used to and knowing how to swim and getting used to being in the water on their own, because even with that, those things can fail. So just generally knowing what you do, that's a very good point. Thank you for that, because I was kind of looking at it from the other perspective.
Yeah.
Sticking with the outdoors, we talked about dehydration a little bit, but we also have, outside of dehydration, we do have issues with potential like heat exhaustion and heat stroke. And again, it is hot as God knows what outside this summer already, and we're not even in August yet. What are some symptoms of heat exhaustion and heat stroke in children, and how should parents or caregivers, program leaders respond if they suspect that their child or a child in their care is suffering from either heat exhaustion or heat stroke?
Yes. And so those are two different illnesses, and one is, a sequela of the other. So heat exhaustion symptoms would look like heavy sweating, weakness, being cold, the skin is very pale and clammy, and the child may have a fast and a weak pulse. They may be nauseous, or they may even start vomiting. And at that point, you want to move the child from whatever activity they're doing to a cooler place. You want to give them some water, apply cool, wet cloths, and see how they're progressing, right? If we're at the point where we have a heat stroke, meaning that the temperature of the body is really high, the child is hot, red, dry skin, their pulse is really rapid and strong, but they're possibly losing consciousness, obviously you call 911, right? You move to a cooler place. At this point, you would not give any kind of water to the child, because they may be in a point where they're not able to protect their airway. And so you're waiting on emergency medical response at that point, and just trying to cool the child down with cool cloths or a bath, but do not give fluids at that point. And it's just really important, especially for the people that are running camps this summer, to know the difference, to be able to recognize those signs and know when to seek professional medical help.
Okay, so that's an interesting point too. Do we have are there training programs, or, because I know we through our Institute of Learning offer a number of different things. Are there programs that exist for people who are leading summer programs and things like that, to be able to guide them through the process of recognizing, not just these, but other potential issues and other potential symptoms of other things as well, where people can kind of get more information about that? Because I imagine that would be very helpful when you're in that space.
Well, certainly here at Doctors, we're available for consultation for camps, from a medical perspective, to make sure that they're safe and ran in a proper manner. So like I said, I'm here in Nassau as well as Grand Bahama, available for consultation for those reasons, as well as, making sure that your camp counselors and whoever you have employed are CPR trained, and just being very mindful of where the children are, how long they've been out, and making sure that hydration status is being monitored closely.
Okay. Boy, this next question is a big one for me, because again, like I said, my kids suffer with the mosquito bites. Is there any way to prevent bug bites and stings? And then what are some of the best treatment options? Now, I'm going to ask you this from your standpoint as both a physician and as a mom, because I know there's the traditional medical approach, and then there's also, the mom's wisdom, intuition, and passed down through the years. So I'm going to ask you on both sides. But what are some ways to either, to prevent and then to treat if you do come across, especially if it's a bad sting or a bad bite?
Yeah. So these mosquitoes are literally everywhere. You open your door, they fly in. You open your car window, they fly in. They're causing you to swerve off the street because you're trying to get the mosquito from outside,
right?
Outside of the car. But it's really important to just, if you're going to be outside, some people are having family reunions. You want to have a beach day. You're having a pool party at your house. Insect repellent is going to be your first line of defense. You want to make sure there's no standing water where mosquitoes can breed, essentially. It says to wear long sleeve clothes, which seems counterintuitive, right? And sometimes these mosquitoes will get up under your jeans for some reason. They're not made like they're used to. But you just really, really want to make sure you're taking every precaution that you can have these mosquitoes actually growing around your yard or around the areas where children are playing. And then in terms of treatment, right? So after the mosquitoes has feasted, for some people, they have really bad reactions, right? I'm one of those people weeks later I'm still, suffering from the swelling of the mosquito bite. And so as best as possible to, apply some hydrocortisone, which is over the counter. I would definitely start there to just prevent itching for the child, right? So if they start scratching and then they cause an open wound, that's when you have to come and see us because we maybe need to do a little bit more. But some hydrocortisone. And, everybody grew up with a grandma, old school. There's aloe, right?
Always aloe.
There's always aloe, right? And I've used some local products as well since I've been back. And neem has helped a little bit when I've traveled, especially. I take neem with me if I'm going to like Exuma or, I just feel like the mosquitoes on the family islands are a little bit, they're a little bit more robust and a little bit more gangsters.
That is the word. That is the correct word.
So I've taken some neem with me and all of us as pediatricians, as family physicians, we do have our little tricks up our sleeves that we give our patients. But generally, insect repellent is going to be your first line of defense, and then avoiding any kind of standing water or areas where they can breed and having children play around them.
Yeah. I have a cousin of mine who was working at cable probably about a decade ago, and he went to Centreville to do some work. And he has this photo that he had as a profile photo for a long time of this, what I thought was the most ridiculous getup when I saw the photo at first. And then he sent some follow-up photos and videos of just the amount of mosquitoes, sandflies, and the whole line. He looked like he was ready to go. Like, it was astronaut level the way he was covered. And yeah, the family island insects are an entirely different breed. Like I remember, again, spending summers in Long Island, sleeping in a room, and the spider that was crawling on the bureau was so heavy that you could hit. Sorry, Gally, you could hit a. And I'm like, that's the creepiest. So you can imagine being 10 and you just hear it and you're trying to figure out what it is, and you look and there's this spider just. Listen, yeah, the family island insects are different. It's just completely different. So we are having a great conversation with Dr. Teykia Deveaux about how to keep kids healthy during the summer season. We are going to take a quick break for some words from our sponsors, and we'll be right back on the Doctor's Hospital podcast.
Are you seeking exceptional health care beyond the traditional hospital setting? Introducing Doctor's Hospital Clinics, your trusted destination for comprehensive care. Our full-service locations provide affordable services through our Loyalty Advantage membership program and NHI. Experience seamless care with our integrated health system, where your medical history travels with you, ensuring continuity of care. Book an appointment today at clinics.doctorshosp.com. We make primary care easy.
Welcome back to the Doctor's Hospital podcast. We are continuing our conversation with pediatrician Dr. Teykia Deveaux, talking about keeping your kids safe and healthy during the summer months. We talked a little bit earlier about, some of the outdoor activities. And obviously, like you said, we're an island nation. We are surrounded by water everywhere we go. You're never more than 5 or 10 minutes away from a beach, a pool, something along those lines. And we know it's hot as, Satan's backside out there. So, what are some of the best practices for ensuring water safety when children are swimming either in pools or, if they're in a lake, if they're at the beach? What are some, just safety measures that parents can take for their kids when they're engaging in water activities?
Yeah. So, number one is going to be supervision, having a dedicated adult to watch children, whether they're at the beach or in a pool, for the entire length of swimming, right? Even if they can swim, you should have a dedicated person watching them while they play and engage in the swimming activity. Next would be swimming skills. You have to learn how to swim. So I know, we'll quote unquote doggy paddle or just stay in the shallows, stay by the stairs. But children are curious. Children are inquisitive. They are daring and they can be fearless. So it's very important you turn your back for a second. They are wanting to follow their older sibling or wanting to follow their friend. And they don't realize that, that's 6 feet deep, which is taller than them. So very important to engage them in swimming lessons as early as possible and to do it over and over, right? So you can't do swimming lessons, when they were 3 and then just set it and forget it. Right. You have to keep practicing to make sure that the skill is up to par and that they exactly know what to do, right? And then last but not least would be life jackets, right? I think it's very important for parents to have the appropriate vest for children. especially for those that are going out on the boat, right?
Mm-hmm.
We've had a number of boat accidents,
Yes, we have.
unfortunately, but they have been quite frequent, I would say, for this first half of the year. And so children, if there are no straps on when you're on the boat, right?
Mhm.
You're just sometimes sitting on, or
It's
they're
loose.
sitting on the back, you're loose,
Mhm.
right? So if you can't swim, it makes it a lot more difficult to rescue somebody that fell overboard.
Right.
So having life jackets, especially when boating, even if it's just you're going right out the harbor,
Right.
going to, right to another island, similar kind of concept,
Mhm.
just how you put on your seatbelt in the car if you're going right to the food store.
Right.
If you're
It's
just
the same
going
thing.
right to Harbor Island,
Mhm.
please make sure that, life vests are on board, and the kids really do have them on, especially for young and inexperienced swimmers.
Yeah. I mean, that's the thing too, though. Even some of the boating accidents that we've seen, it has been a lot of this right in the harbor type stuff in any event. So, you really shouldn't take that for granted. And I think, I imagine you were talking about having like the designated adult for monitoring. I presume, because we have to talk about these things in context, right? So you're talking about summer, there's parties, there's going to be alcohol, things like that. I imagine your designated person to watch the kids should be like a designated driver in that they're fully sober and paying attention to that in that regard.
Yeah, that's absolutely correct. So you have a designated adult person. Now maybe you switch off, hey, I'm going to watch the kids for these 2 hours, and then I'll enjoy myself, and then somebody else, but you have to be sober.
Yes.
And able to focus on what's the task in front of you.
Right.
And just make sure you're doing just that. So you can't be on your phone scrolling. You can't be checking TikTok and Instagram. You literally have to be watching all ends of the pool, constantly scanning. And if you feel like you want to have a really big party, you can hire lifeguards, right?
That's
I think
true.
people don't think about that, but there are people that do this for a living. You can hire them to watch so that you can fully enjoy your event that you're having. So just safety is paramount.
Right.
You don't want to look back with regret, right?
Right.
I could have, should have done this. Whereas we're giving you the tools, giving you the skills, telling you what can do for prevention.
Yeah, I guess the same way people would hire police officer potentially for security at a party. It's the same idea, right? You get a professional. If you're going to, I do find too, though, what I've seen a lot of people doing is shifting away from, even when they're doing pool parties, away from, in the ground pools into more so like the water slides and things like that. So I find that people have also kind of like taken some shifts at how they approach things. If it's a larger group, especially if it's mixed company, different families, things like that. I think that's what I've seen a lot of parents doing with some of these kids parties, is moving away from, hey, everybody jump in the pool, and then getting these big inflatable water slides and stuff like that, I guess, to the end of having it being safer than the beach or the pool. Now I would say we've had a number of conversations on this podcast over the past few months, and this next conversation always comes up because nutrition is obviously a key component of health. And similarly, we can't talk about kids' health without talking about nutrition. Now, we know summer is an entirely different ballgame. Everybody has a routine when it's school time, breakfast, lunch, whatever. You send money to the school for lunch, whatever it is. But we know summer is a lot more laid back. It's just like, I don't have to worry about that to the same degree, right?
Yeah.
But obviously, you still want to make sure that your kids are healthy. So what are some healthy and refreshing summer snacks and meals for children? And how can parents manage their children's diet to prevent heat-related problems? Or I guess just, putting on a couple of pounds just because it's summer, because, we tend to eat a little rich, especially in summertime.
Summertime is so tricky. I think it's the time of never-ending stomach, right? Your child no longer has a breakfast, lunch, and dinner stomach. They have stomach for all hours of the day.
Yeah. They just go on the seafood diet.
Absolutely. They see it in the fridge. They want to eat it. It's just like you didn't even go to the store. So I talked about it earlier, but it's really just having those fresh fruits and lighter foods available that is easily accessible for kids. You maybe don't have to do that hot breakfast in the morning because they're not off to school. So maybe you can switch to doing a smoothie, having some fresh fruits, some vegetable sticks, some yogurt, even the frozen yogurt, something a little bit lighter, right? And even when you're thinking about your meals, right? Try to sway away from the heavy starch Bahamian foods that we're liking. Or if you're still going to continue with that, do with smaller portion sizes, right? Because especially if your kids are at home and they're not super active or they're not at camp, you don't want them just sitting with these heavy calorie meals. and literally planted in front of, the TV or just lounging on your couch all day. So you want to do with lighter foods, etc. And then heavy, aggravating heat foods, you want to just stay away from the sugar as much as possible, right? So limit the sugary foods, limit the fried foods, the heavy foods, and because those will typically cause more dehydration, making you feel a little bit more sluggish, right?
Right.
That donut tastes really good at 2:00, and then 2:15, you're like diving counts, crashing. So just as best as possible, fresh fruits and vegetables as you can, make them accessible, make them fun, cut them up already for them. They don't have to come and ask you, can you cut this up? Can you peel this for me? If you do all that little prep in the morning or even early in the week with the mandarins, depending on how old your kids are, if you cut up the oranges, have it in a bowl, hey, go at it.
Yeah.
Right? That makes it a lot easier, especially as a parent.
Yeah. Because I imagine just as meal prep makes life easier, generally speaking, and in summer it's still the same thing, right? Because it's a lot easier if your kid is old enough to go to the fridge and say, hey, look, there's fruit in the fridge. You know what I mean? So obviously we've talked a lot about what sounds mostly like homegrown vacation type activities, right? But obviously travel is a big part of what happens in the summer as well. So when you're talking about travel during the summer, what health considerations should parents keep in mind, especially regarding things like vaccinations and preventing illness? And I imagine because you have some parents who are taking their kids sometimes to exotic places and things like that, where there's a lot of things you ought to consider. So, what should parents keep in mind as they prepare potentially for travel for summertime?
So obviously it depends on where you're traveling to, right? If you're going on one of the exotic fancy vacations to more far-flung destinations, which can be really exciting, you do want to check whatever that country is and their required vaccines, which they will usually have listed on some website, and that's very important to make sure. But the regular routine immunizations, you should make sure your children are up to date as well before travel. And then obviously when you're traveling to prevent illness, you want to just practice good hygiene. So washing your hands, soap and water is still key, right? You have all the hand sanitizers if you can't access, but soap and water is still the best one. Obviously, like I said, using insect repellent and being good cautious about the type of foods you're eating, where you're eating from, and then staying hydrated, right? Nobody wants to be sick on vacation. So as best as possible, be prepared. And like I said, good old-fashioned washing your hands is probably going to be the best when you're traveling on the plane, wiping stuff down. COVID is still out there, right? But, the run-of-the-mill summer colds, summer rashes and stuff will occasionally happen. But as best as possible, just, I think a good nutritious diet, good sleep during the summer, which is, again, good stuff because you're off your routine. And then lots and lots of hand washing. It would be the name of the game.
Okay. In terms of allergies, because that's another issue that kids tend to be faced with here and there. How can parents help to manage summer allergies? So things that maybe like, if you have an asthmatic kid or someone who just has general, it may not be as much as asthma, but just general allergies to things like pollen or, air quality and other seasonal issues like that. How can parents help their kids to manage those things?
I think the first thing would be to know your kid's triggers, right? What triggers my child's allergy? Is it the pollen count? And if I take note of the pollen count, maybe I don't have them outside that day, right? Because that one day can cause me 3 or 4 days of dealing with symptoms. So taking note of that, maybe limiting their outdoor activities during that time. Patients with allergies, if they have them and they're using medicines on a regular basis, make sure they're taking the medicines on a regular basis, right? And it's the same thing, especially for those children with asthma. If they're on a medication that requires them to take it every day, make sure they're taking it every day. If they're going to be engaged in camp, make sure that the camp counselors know that they're on this medication so that if something happens, they can have a plan for it. Those with asthma, those with allergies should have what we call an action plan. And it's a very short, detailed handout that can be given to grandmas, to aunts, uncles, etc., so that they know the plan if something were to happen and the child gets themselves into some sort of trouble.
And like you mentioned, I think, summer is a time where a lot of things are off routine. So it's trying to remember to stay on routine for things like you said, if kids have regular medications and things like that, just trying to stay on schedule. All right, so we touched on this a little bit earlier, and I know this can be a very difficult conversation for parents, especially in this age, because there's so many easy ways to just kind of have your kid just engage in technology or screen time in particular. Um, so how do we balance, given everything that we know? So we know that it's really hot outside. We know that we've had already a heat wave already for the season. But we also know that we don't want our kids to just be engulfed in the screen all day. So how do we find balance, given all of the factors and considerations between screen time and physical activity?
So to be honest, Alexis, we come back to that word routine.
Mm-hmm.
So routine does not mean you have to be super rigid, super strict, like,
Mm-hmm.
during the school year. But during the summertime, you can still create some sort of routine for
Mm-hmm.
them as to how many minutes of the day,
Right.
how many hours of the day you're going to allow them to be on their Game Boy or their tablet, or I said
Wow.
Game Boy, right?
Yes, I love it.
I took it all the way back.
Yeah.
So I can tell you,
Oh,
iPads,
I love
MacBooks,
it.
whatever they're playing these days, you want to make sure you set a specific time. So if they want to use up their 2 hours from
That's
9
it.
to 11, then that's it for the day. And that doesn't get renewed until the next day, right?
Uh-huh.
And it's really, really, really important to do that. You want to encourage kids to be as physically active as possible this summer. It's okay for them to be bored. We as parents don't have to entertain them the
Every
entire
second of the
time,
day,
right? They can become creative. They come up with things. We did it as children,
Mm-hmm.
right? We didn't even have all of these things.
Mm-hmm.
They actually can even ask Alexa
Right.
to
Right.
come up with something for them to do. I've
Oh.
seen it all.
Mm-hmm.
So I think it's just really important to limit that screen time. Encourage reading this summer, right?
Mm-hmm.
We really want to avoid that brain drain. We've seen that kids returning to school will lose approximately about 2 months of the grade level proficiency that they had before the summertime began,
Wow.
right? And that was really interesting for me to remember that fact. 2 months is a whole lot of time, right? And so
That's a quarter of the school year.
yeah, so just during that
Roughly.
summertime, you're not doing anything, not engaging your brain, those multiplication tables,
Right.
those facts that they would have learned during the school year. It's really important to make sure to prevent that summer slide is what we call it.
Right.
Have them engaged. So even if they're practicing writing, nothing strict, they can write about pretty much anything they want to, but they're engaging those handwriting skills, encouraging creative play. Summer reading, it doesn't have to be hours upon hours,
Right.
maybe 10 to 15 minutes at least a day, especially depending on the age group. And that really encourages them to build their vocabulary. Reading is like number one for me as a pediatrician, as a parent, as a mom. Once you can read, you can pretty much do anything.
Right.
Right? You can't figure out a math problem if you can't read it.
That's correct.
So once you encourage reading with our children, I think they can kind of take the lead and go anywhere they want to go. So at least 10 to 15 minutes a day. And I mean, I know sometimes you're like, well, I don't know what we're going to do with these kids. You can make anything educational.
That is true.
You can make anything educational, right? And so for the toddlers, especially now that my son is a little bit older, he turned 1 recently. I can put him in the grocery cart. He can roll around. I can start pointing out stuff to him, right? Now it makes my little trip to Super Value a little bit longer, but I can engage him,
right?
If you have to take him with you,
It's funny that
right?
you mentioned the food store, right? Because so for one of the things with our daughter, she's 6. What we're doing now is when we go to the food store, it's like, okay, so this item is, $6 or this is $5, and then practicing the math in that space. Because obviously, she's her reading is good. She has all of that down, but it's like, okay, so if you want to take your math skills to a different level, then we kind of focus in on that. So it is kind of taking advantage of those everyday opportunities to make them educational. And I think, I think there's a lot that's out there. Like I know the school that my kid goes to, they offer what they call bridge books. And I don't think it's specific to them. I think this is just a thing that exists.
Right.
So, if your kid is going from 2nd to 3rd grade, you can go and find the bridge book for 2nd to 3rd grade and have them do that. So what it does is it reinforces some of the things learned in 2nd grade and then adds in some of the things that are expected to start to learn in 3rd grade. And so that's the bridge concept. Yeah. And I think it's specifically to kind of target this idea of the summer slide and finding ways around it. So there's very practical in your everyday routine, which is helpful because then kids get to learn, well, no, I should be able to know if I'm going into the store and I have $50, which is in the store nowadays not much, but you kind of know, well, okay, if I get this, and this, my $50 is gone. It's practically helpful in that way as well. Yeah. But I do think there are a lot more resources. from my perspective, it feels like there's a lot more resources available today
Mhm.
than it was, when I was growing up. And I do think as well, know your kid. I
Mhm.
think that is such a critical component of conversations
Mhm.
like these. And then because, like screen time can be such an interesting concept. So, if they're into art
Mhm.
and, you're exhausted of the crayons or
Mhm.
having to sharpen color pencils and
Mhm.
things like that, you have a drawing app on a tablet
Yep.
and you might view that a little bit differently as screen time if it's something in that vein, right?
Mhm.
So I think it's interesting to kind of just consider all of these different sort of aspects of it
Yeah.
because you also don't want to take the advice and be like, Dr. Deveaux said it has to be 8. It's like, no, just know your kid, know kind of what they're into and try to also navigate within that space.
Right.
So that you're being as helpful to their growth and development as possible.
Yeah. So you definitely obviously want to parent the kid you have is usually what I say.
Mm-hmm.
And comparison is a thief of joy.
Mm-hmm.
You can have 20 kids and from the same mom and dad, and they are 20 individual people. I love to remind my parents that you gave them different names for a reason, right? And
Right.
so utilization of the screen and good screen time versus not is definitely important.
Mm-hmm.
But it's summertime. The best thing would be physical activity as much as possible.
Right.
You're breaking from the routine of school, of sitting in classrooms for hours upon end, throughout the year. As much as you can get them up and active would be great. And again, just to prevent that brain drain or that summer slide, just really encourage creative play, summer reading, and practicing those writing and handwriting skills so
Mm-hmm.
that, it's July, so August is next month.
Right there.
It's right there. The transition back to the routine of getting up in the morning may be tough, but at least when they get into school and getting engaged in the actual material,
Mm-hmm.
it wouldn't be so far,
Right.
so far away from what they've done this summer.
Right. Awesome. This has been a very great conversation. So, I always like to give people an opportunity. You've been working in our Grand Bahama spaces for a while, and then you recently started doing clinics here in New Providence. So let our listeners know, if they were interested in setting up an appointment with you, or if they are someone who's running a camp later in the summer and they maybe want to get some guidance and advice on how to manage the health space. Where can people get in contact with you? When and where are you? Because obviously you're working between 2 islands. Let the people know how they can get in contact with you.
So I am currently at the Centreville Medical Center, our CMC location, on Mondays, and on Fridays you can find me at our Carmichael location.
Mm-hmm.
I'm there all day, and in Grand Bahama we're there on a scheduled monthly visit for clinic.
Right. So if you're in Grand Bahama and you want to know, we'll have that information posted on our social media, so you can follow us on Facebook, Instagram, Twitter. For that information. If you want to call the CMC location, the number is 302-3250. If you want to call the Grand Bahama location, you can call at Freeport Medical Center, which is 350-4490. And you can also actually book a visit online. So you can visit clinics.doctorshosp.com, and then you can go to the clinic of your choice and set up an appointment via our website as well. So I want to thank you so much, Dr. Deveaux. This has been a great conversation. Thank you for taking time out of which is obviously a busy schedule as pediatrician, as physician, as mom. I want to thank you so much for your time.
Thank you for having me, and I look forward to the next time.
Awesome. And so we, as always, like to encourage our audience to like, comment, subscribe, and share. And we'll see you back here next week on the Doctors Hospital Podcast.
Experience the immediate care you deserve at Doctors Hospital Urgent Care. When emergency strikes, trust our expert physicians for fast, quality care. With extended hours and cutting-edge medical technology, we're always ready to serve you. Don't wait or take risks with your health. Visit our urgent care suite at Doctors Hospital West on Blake Road for immediate, trusted, and best care.